Hello everyone, I am Lata Srikanth. I am a nurse. In this video, I am going to show you how to do the manual lymphatic drainage and exercise for patients who have head and neck cancer. We know that when patients having a head and neck cancer due to the growing tumor or because of the surgery or the radiation therapy, the normal lymphatic flow can be affected. In order to stimulate and drain the fluid and remove the toxins and to increase the interference of immunity, we have to stimulate the lymphatic drainage. This can be achieved by lymphatic massage and also the exercise. So before going to do the procedure, I wanted to give you the key points. First one is we have to do this massage and the exercise in the early morning, because throughout the night we are lying down. Because of the gravity, the fluid increases in the head and neck, which causes stiffness. Because of the accumulation of fluid, which causes stiffness, and it interferes with the sleep, swallowing and the speech. So we have to do it in the early morning to drain the lymph. Second one, we have to do the massage and the exercise on the unaffected side so that the fluid can be drained from the affected side. The third one is when we are doing massage and exercise for the head and neck, we have to start from the lower end so that we can drain the fluid. Fourth point, if you have severe pain and if the wound is fresh, or if there is a cellulitis or lymphoria, you are not supposed to do the massage and the exercise. If you can manage the pain, take the medicine 1 or 2 hours before, then you perform the exercise and the massage. And we have to use the palm to do the massage. So keep the palm moist but not very dry. And we should not have any of the ornament. We are supposed to remove all the ornaments before doing the procedure, and all the garments should be loose while doing the procedure, and also all the nails should be cut short because it can injure the skin. So these are the key points you have to remember. So now first I am going to show you how to do the lymphatic manual drainage. Before doing, we have to stimulate the lymph nodes which is there in the abdomen. So for that we have to do the take the deep breath. While taking the deep breath, you have to push the abdomen out. So I'll show you now. This every step you have to do it for 10 counts. So now I'm going to start the procedure. So you have to hold the hand like this. Then you have to press gently and take the deep breath. Like when you are blowing it out, the abdomen has to go inside. So like this you have to do. Like this you have to do it for 10 times over the abdomen. Next, using the palm like this, you have to stimulate the axillary area. Like this you have to do it like this. Okay, so you have to do it like this for 10 times. Not pressing too much, you have to do it gently. 10 times you have to do. Then simultaneously you have to do it on the other side. Like this you have to do it for 10 times. Then you have to stimulate the lymph nodes which is there in the neck. 10 times you have to do the massage. Here we have many lymph nodes which need to be stimulated. Okay, next you have to do it on the shoulder. So every step you have to do it for count of 8 to 10. Okay, next you have to drain it like this 10 times. Since we have a delicate part here, we are not supposed to do it simultaneously. Okay, now to the face, you have to divide the face into 2 parts and then you have to drain it. Here usually many of them have the fluid accumulation here, so you have to do it gently like this. And for the ear, you have to do it like this. Okay, and the face. Every step you have to do it for 10 times. Okay, then the lips. Then the lower part of the eye. Next, the upper, you have to do it very gently. Then to the forehead. So if you cannot do simultaneously, you can do it like individually also. Now we have to start from the upper area and drain it. We also have to stimulate the lymph nodes in the occipital region. Like this for 10 times. Then you have to drain it in the axillary nodes. Okay. Then you have to complete it with a deep breath. Similar way how we started, take a deep breath. this you have to end the massage. Now I am going to do how to do the exercise for patients who have head and neck cancer, and this also starts from the taking the deep breath. There are 11 steps, and usually when we have leg and hand and leg edema, we used to wear the garments or the hoistry or the bandage. With that only we used to do the exercise, but it is not possible for the head and neck. But if it is possible, it can be done with the bandaging itself. It can be, exercise can be carried 2 to 3 times a day, but better to do in the early morning. Okay, so this exercise also starts, first step is the deep breathing. So similar way, you have to gently press the abdomen, take the deep breath, like this. You have to do it for 10 times. This is the first step. The first is the deep breathing. Second one is the head rotation. You have to turn the head to one side. 1, 2, 3. Like this you have to do it for 10 times. The next step is the ear has to touch the shoulder. 1, 2, 3. So like this we have to do it for 10 times. Next is the chin has to touch the chest. 1. Look up. 2. No need to stretch. 2. 3. So like this we have to do it for 10 times. Next is you have to bring the head like protrusion and retraction like this. 1, 2, 3. So like this you have to do it for 10 times. Next you have to do it for the shoulder rotation like this. You have to complete rotation of the shoulder. You have to do it for 10 times. 1, 2, 3, or you can do it in the opposite side. 1, 2, 3. So like this you can do. Next we have to squeeze the shoulder. Okay, like this. 1, 2, 3. So like this you have to squeeze. The next step is you have to hold the hand like this behind and squeeze like this. 1, 2, 3. So like this you have to do it for 10 times. Next you have to do it for the jaw lateral like this. 1, 2, and 2, 3. Like this you have to do for 10 times. The next is you have to tightly hold the mouth and wide open. Like this you have to do it for 10 times. Next you have to do for the eyes. Like this, wide opening the eyes and tightly holding the eyes. Wide open, tightly hold the eyes. Wide open, tightly hold the eyes. Wide open, tightly hold the eyes. Now you have to end the exercise with a similar breathing exercise. We have to take the deep breath. So like this you have to do the exercise and the manual lymphatic drainage. I hope you continue to do the exercise and massage and improve your quality of life. Thank you.